There is a pill that over 70 million people take every single morning. They take it with their coffee, they take it without a second thought, and most of them have been told it's safe, well tolerated, and one of the most reliable medications out there. And for a lot of people, that's true. But for others, something starts to change. Maybe it starts as a little swelling in the ankles that the doctor waves off, or a headache that keeps coming back, or a heartbeat that feels just slightly off. And they ignore it because they trust the medication, because nobody told them to watch out. What if I told you that some of the most dangerous side effects of this drug are also the most commonly dismissed ones? That people are walking around right now with early warning signs, and they have no idea? The drug I'm talking about is amlodipine, and today we are going through the 8 worst side effects that you should never, under any circumstances, ignore. If you take this medication, or if someone you love does, please watch this to the end. It might be more important than you think. Before we get into the list, let's take just a moment to understand what amlodipine actually is and what it does inside your body. Because once you understand the mechanism, the side effects will start to make a lot more sense. Amlodipine is a calcium channel blocker. It was approved in the late 1980s and has since become one of the most prescribed medications in the entire world. It works by blocking calcium from entering the smooth muscle cells in your blood vessel walls. When calcium is blocked, those muscles relax. When those muscles relax, the blood vessels widen. When the blood vessels widen, blood flows more easily and blood pressure drops. Simple in theory, effective in practice. And for the majority of people, the side effects are genuinely mild. Maybe a slight headache in the first week, maybe a little ankle puffiness, and then nothing. But the human body is not a simple system. And when you interfere with calcium signaling, which affects not just your blood vessels, but your heart muscle, your gum tissue, your liver, your skeletal muscles, and more, you open the door to effects that go far beyond a little swelling. What we're going to cover today are not the mild inconveniences. We are talking about the side effects that, if ignored, can turn into something genuinely dangerous. Some of them are rare, some of them are surprisingly common, but all 8 of them are things that your body will try to warn you about, if you know what to look for. Let's get into it. Let's start with the most common one, and the one that people most often brush off because it seems harmless on the surface. Peripheral edema, swelling in the lower legs, ankles, and feet. Here's what's actually happening. When amlodipine relaxes and dilates your blood vessels, the pressure inside those vessels changes. Fluid that would normally stay contained inside the vessel walls starts to leak out into the surrounding tissue. And because gravity pulls everything downward, it collects in the lowest parts of your body, your ankles, your feet, sometimes your calves. Now, a small amount of this is expected and usually not dangerous. If you notice a little puffiness toward the end of a long day, and it goes away overnight when you elevate your legs, that's likely just your body adjusting. Annoying, but not alarming. But here is when it becomes something you cannot ignore. When the swelling is there every single morning when you wake up, before you've even been on your feet. When it's climbing up past your ankles toward your shins or knees. When pressing your finger into the swollen area leaves a dent that takes several seconds to fill back in. That's called pitting edema, and it means significant fluid has built up in your tissue. Why does this matter beyond discomfort? Because severe, persistent edema can be a sign that your circulatory system is under real strain. It can mimic or mask the early signs of heart failure, where the heart is no longer pumping efficiently enough to clear fluid from the body. It can also create conditions where blood flow in the legs slows down, raising your risk of developing a blood clot, also known as deep vein thrombosis. And here is the detail that too many people miss. If the swelling is only on one side, just the right leg or just the left leg, that is a red flag for DVT specifically. And you should seek medical attention the same day. Bilateral swelling that is worsening over time while on amlodipine is a conversation for your doctor, not something to manage with compression socks and silence. The entire purpose of amlodipine is to lower your blood pressure, but the body has a very narrow range in which blood pressure works optimally, and when it drops too low or drops too quickly, you start to feel it immediately. What most people experience is something called orthostatic hypotension. This is when your blood pressure drops suddenly as you move from lying down or sitting to standing upright. Your cardiovascular system normally compensates for this shift automatically and almost instantly, but amlodipine can blunt that response. The result? You stand up, and within seconds, the room spins. Your vision goes dark at the edges, there's a rushing sound in your ears, your legs feel weak, and in some cases, you lose consciousness completely. Now, a mild version of this, feeling slightly lightheaded once in a while when standing up too fast, is something many people experience and isn't necessarily dangerous on its own. But here is why you cannot afford to ignore repeated or severe dizziness on this medication. First, the obvious and immediate danger: falls. Fainting or stumbling from dizziness causes serious injuries, especially in older adults. Broken hips, head injuries, and complications from falls are among the leading causes of hospitalization in people over 65. Second, and this is less obvious but deeply important, when your blood pressure drops significantly and repeatedly, blood flow to the brain is reduced. Consistent underperfusion of the brain, even in brief episodes, is associated with cognitive decline, memory problems, and an increased risk of ischemic stroke. If you're experiencing dizziness on amlodipine more than occasionally, or if you have actually fainted, your dose may simply be more than your body needs right now. Blood pressure targets and medication doses should be regularly reassessed. Don't wait for your next scheduled checkup. Call your doctor and tell them what's happening. This is the one that really catches people off guard. A heart medication causing heart problems? It feels contradictory, but understanding why it happens makes it easier to recognize. When amlodipine lowers your blood pressure, your heart sometimes responds with what's called reflex tachycardia. The heart, sensing that blood pressure has dropped, essentially kicks into a higher gear to try to compensate and maintain adequate blood flow throughout the body. It beats faster, and in some people, that manifests as palpitations. Palpitations can feel different for different people. Some describe a fluttering feeling in the chest, like a butterfly trapped inside. Others feel a heavy pounding heartbeat, like their heart is working too hard. Some feel a skipping sensation, as if the heart momentarily paused and then caught up. Others feel an irregular rhythm, where the beats don't come in a steady, predictable pattern. In the early weeks of starting amlodipine, mild palpitations that come and go are relatively common and often settle on their own as the body adjusts. But here is the line you must not cross without seeking help. If the palpitations are frequent, happening multiple times a day, if they are prolonged, lasting more than a few minutes, if they come with chest tightness, pain, or pressure, if they come with shortness of breath, if they come with lightheadedness or a feeling that you might pass out, any of these combinations is a medical emergency. The deeper concern is that amlodipine, in some people, particularly those with existing heart conditions, can contribute to arrhythmias. One of the most serious is atrial fibrillation, where the upper chambers of the heart beat chaotically and out of sync with the lower chambers. Atrial fibrillation dramatically increases your risk of stroke, up to 5 times higher than in people with a normal heart rhythm. The heart does not give endless warnings. If it's talking to you through palpitations, listen. Headaches appear on virtually every medication side effect list in the world, and because of that, people have learned to dismiss them. Oh, it's just the medication, it'll pass. And often, they're right. Mild headaches in the first week or two of amlodipine are common and typically resolve on their own. But there are specific types of headaches associated with this drug that you should never normalize. Because amlodipine works by dilating blood vessels, it also dilates the blood vessels in your brain and skull. This vasodilation is what triggers headaches in the first place. The vessel walls stretch and activate pain receptors. In some people, this produces a throbbing, pulsating headache that feels like it's beating in time with their pulse. It's often felt behind the eyes, at the temples, or at the back of the head. If this type of headache is happening regularly and not fading after the first few weeks, that's worth discussing with your doctor. It may indicate that your blood vessels are consistently overdilated and that your dose or medication needs to be adjusted. But here is the headache you do not wait on, not even for an hour. A sudden explosive headache, one that comes on in seconds and reaches maximum intensity almost immediately. is sometimes described by doctors as a thunderclap headache. This is one of the most serious warning signs in all of medicine. It can indicate a hemorrhagic stroke, a ruptured brain aneurysm, or a hypertensive crisis, a sudden and extreme spike in blood pressure that can cause immediate damage to the brain, heart, and kidneys. The cruel irony is that people on blood pressure medication are sometimes less vigilant about these signs because they assume the medication is keeping them protected. It is not a perfect shield. If a headache ever hits you like a wave crashing without warning, and it is the worst headache of your life, call emergency services immediately. Do not drive yourself. Do not take a painkiller and lie down. This is not a situation where watching and waiting is appropriate. This one surprises people almost every single time. And because it's not something most people associate with a heart or blood pressure medication, they often spend months wondering what's happening to their mouth before anyone connects it to amlodipine. The medical name is gingival hyperplasia, and it affects somewhere between 1 and 2% of people who take amlodipine, which sounds small until you remember that tens of millions of people take this drug. That adds up to hundreds of thousands of people. Here is what happens. Calcium channel blockers like amlodipine interfere with the normal regulation of fibroblast cells, the cells responsible for maintaining the connective tissue of your gums. Without proper regulation, these cells overproduce. The gum tissue thickens. It swells. It begins to grow over the surface of the teeth in a way that looks and feels abnormal. In mild cases, the gums may simply look puffier or feel more sensitive than usual. In more advanced cases, the overgrown tissue can partially or even significantly cover the teeth, changing the appearance of the smile and making it difficult to chew properly. Now, here is why this goes beyond a cosmetic issue, and why it lands on a list of side effects you should never ignore. Overgrown gum tissue creates deep pockets between the gums and the teeth. Those pockets are warm, moist, difficult to clean, and perfect environments for bacteria to thrive. The result is accelerated gum disease, inflammation, infection, bone loss around the teeth, and eventually tooth loss if left unaddressed. But it gets more serious than that. Periodontal bacteria don't just stay in the mouth. Research has consistently linked severe gum disease to systemic health issues, including an increased risk of heart disease, diabetes complications, and respiratory infections. For someone already managing cardiovascular issues, this is not a trivial concern. If your gums have changed since starting amlodipine, if they bleed more easily, look different, feel swollen and spongy, or seem to be encroaching on your teeth, tell both your doctor and your dentist. There are alternative medications in the same drug class that are far less associated with this side effect, and there are dental treatments that can address the overgrowth, but only if the underlying medication issue is dealt with first. We're going into serious territory now. Amlodipine-induced liver damage is rare. Let's be clear about that up front. But rare does not mean impossible. And because it's rare, it is also rarely the first explanation doctors reach for when symptoms arise, which means it often goes undetected far longer than it should. Here's the mechanism. Like virtually all medications, amlodipine is processed and broken down by the liver. The liver uses a family of enzymes, primarily CYP3A4, to metabolize the drug. In some individuals, this metabolic process generates compounds that trigger an inflammatory response in the liver tissue itself. The liver essentially becomes irritated by its own effort to process the medication. This is known as drug-induced liver injury, or DILI, and it can range from a mild elevation in liver enzymes, detectable only through blood tests, to significant hepatic inflammation, to, in severe and rare cases, acute liver failure. The symptoms are insidious because they look like a dozen other common things. Persistent fatigue that doesn't improve no matter how much you sleep. A dull ache or pressure in the upper right side of the abdomen, where the liver sits. Nausea without an obvious cause. A general loss of appetite that lingers for days or weeks. Feeling like food doesn't digest properly. These are easy to write off. People blame stress, aging, or a stomach bug. They push through it. Then comes the more obvious sign that something is seriously wrong. Jaundice, a yellowing of the skin and the whites of the eyes. Dark, amber-colored urine. Pale, clay-colored stools. itching of the skin without a rash. These are the signs that the liver is no longer functioning as it should, that bilirubin is building up in the bloodstream because the liver can't process and excrete it. If you are experiencing any combination of these symptoms, especially the jaundice, you need blood work immediately. A liver function panel will tell the story quickly. Caught early, drug-induced liver injury is almost always reversible once the offending medication is stopped and the right treatment is given. But a liver that has been under sustained injury for months without intervention is a very different situation. Do not let anyone dismiss these symptoms without running the tests first. Ask any group of people taking amlodipine about muscle issues and you'll get a lot of nods. Muscle aching, cramping, heaviness in the legs, general weakness. These complaints come up far more often than the official documentation would suggest. And yet they are almost always attributed to something else. Age, dehydration, too much time on your feet, not enough exercise. Here is the biology. Calcium is not just important for blood vessels. It is absolutely critical for muscle function. It's the signal that tells a muscle fiber to contract, and it's part of the system that tells the muscle to relax afterward. When you block calcium channels throughout the body, which is what amlodipine does, you affect skeletal muscle function too, not just vascular smooth muscle. The result, in some people, is a disruption in how muscles contract and recover. They feel heavier. They cramp more easily. Recovery after physical activity takes longer. Amlodipine is not a bad medication. For millions of people, it plays an important role in managing blood pressure, preventing heart disease, and extending life. The goal of this video was never to frighten you away from a medication that may be genuinely helping you.